Hi friends, welcome back to the Nurse. In today's video, we are diving into some high-yield MCQs on Foley's catheterization. Perfect for nursing exams and clinical practice. If you want to quick revision, clear explanation and smart rationales, you are in the right place. Let's get started. First question. The primary purpose of using a Foley's catheter is to measure respiratory rate, continuous drainage of urine, to administer IV medications, to measure blood pressure. The correct answer here, continuous drainage of urine. That is a primary purpose of Foley's catheterization. Foley's catheter is used for continuous urinary drainage. Some other functions also there, that is relieve urinary retention, monitor urinary output in critical care, manage incontinence, collect sterile urine sample, instill bladder medications, perform bladder irrigations. These are other purposes of Foley's catheterization. Second question, which part of the Foley's catheter is used to inflate the balloon? Distal tip, drainage lumen, inflation port, catheter hub. Correct answer here, inflation port. There is a two distal ports are there. That one is for drainage lumen, another is inflation port. So here this is a portal proximal tip that is entering into bladder, and this is a balloon that will hold the Foley's catheter inside the bladder. These are the distal tips. So this is used for, this red color tip is used for inflation of balloon, and another tip is used to drain the urine. What solution is recommended for inflating the balloon? Normal saline, sterile water, distilled water, Ringer's lactate. Correct answer is sterile water. Why sterile water means? Usually if saline is used means there is a chance for crystallization and block the tube. So best solution to instill the balloon, that is sterile water. Third question, a male patient requires catheterization. Which size is used? 6 to 8 French, 10 to 12 French, 14 to 16 French, 20 to 24 French. Correct answer, 14 to 16 French. That is used for adult males. So what is the color codes for 14 to 16? That is 14 size is green color and 16 size is orange color. This is usually used for adult male. Catheter enters vagina accidentally while doing female catheterization. What to do? Reinsert same catheter, leave as landmark and use new catheter. Stop procedure, clean and reuse same catheter. So in this case, we will do leave as a landmark and use a new sterile catheter. So why it is making landmark? Because to avoid same mistake again, and also we need to use a new sterile catheter next time. It will prevent contamination and repeat the mistake. Fifth question, most important action during insertion, Foley's catheterization. Lubricate balloon site, maintain aseptic technique, inflate balloon before insertion, keep patient supine. Correct answer here, maintain aseptic technique. Because Foley's catheterization is a sterile procedure, we should maintain an aseptic technique throughout the procedure. It will prevent catheter associated urinary tract infection. So if we are not maintaining a sterile technique, it will cause a urinary tract infection. A catheter associated urinary tract infection refers urinary tract infection that occurs in a person who has a urinary catheter in place. Foley's catheter being indwelling are common source of catheter associated urinary tract infection if not managed with proper hygiene and care. Best method to prevent catheter associated urinary tract infection: fluid restriction, routine 3-day change, closed drainage system, bag at bladder level. Correct answer here, closed drainage system. Because it is a sterile procedure, we need to maintain closed drainage system to avoid entering of a microorganism from outside. Closed drainage system prevents bacterial entry from outside. Seventh question. Balloon should be inflated only after inserted 1 to centimeter, 1 to 2 centimeter in meatus, urine flow seen, patient discomfort, catheter type. Correct answer, urine flow seen. After seeing the urine flow, we can inflate the catheter. So it will confirm the bladder placement. Eighth question. Essential infection control when emptying bag. Empty when half full, bag above bladder, touch drainage spout, wipe spout with alcohol. Correct answer, wipe spout with alcohol. Spout means that tube that we use to drain the urine. The lower side one tube will be there to drain urine, that we need to clean with alcohol before and after the emptying of urine. Wipe spout with alcohol will prevent contamination. So this is a spout. We need to clear first with the spirit. After emptying, again we need to clear it and close it. Last question. Cause of bladder spasms in Foley catheterization. Balloon underinflation, balloon overinflation, catheter blockage, catheter too small. Correct answer is balloon overinflation. Balloon overinflation, it will irritate the bladder wall, that will leads to bladder spasm. So if it is inflated, each catheter has specific amount of water has to be inflated. If otherwise, it will cause bladder inflation, bladder spasm. So that is about today's video. Thank you for watching this video. If you have any doubt means you can ask in comment section. So thank you.